Good evening, everyone. I'm Kim Fuller. I'd like to welcome you to the HR for Health webinar, More Profits and Less Losses, HR Mistakes That Cost You Money. We're going to learn tonight about how to stay ahead of potential lawsuits and how the right HR tools can save your practice time, money, and avoid countless employee claims. If you have questions while we're on tonight, just enter them in the Q&A box. We'll do our best to answer them at the end. We're so excited to have Ali Oromchian. He's the co-founder of HR for Health, presenting for you this evening. Little bit of background, HR for Health is a cloud-based human resources software designed to simplify human resources for healthcare practices. So without further ado, I turn it over to Ali.
Awesome. Thank you, Kim. Thank you, Kim. Welcome, everybody. We're excited to have everyone on. We are going to be going into really the deep dive into the things that a lot of people, for the most part, forget about HR that causes them a ton of headaches. And I can tell you, going from the craziness of COVID to reopening and now coming into 2021, that craziness has continued in the HR world. Because COVID has put an absolute hot spotlight on everything having to do with employee issues. And related to that are the topics that we're going to talk about today. Because at the end of the day, the value of your practice, the ability for you to create wealth, the ability for you to grow and invest in other things, whether it's expansions or marketing or anything else within the office, relates to you maximizing your profits. Now, unlike a marketing strategy, where there may be things like creating a website and sending mail pieces and things of that nature that increase your top line revenue. Our goal, and my goal really for creating HR for Health from the very beginning, was to minimize your exposure, minimize your risks and liability. Why? Because if I can reduce your risk profile, if I can minimize it by doing some very simple, straightforward HR strategies, then that leaves a lot more on the table for you in terms of profit for you to reuse in a much more effective way. And I can tell you, just like you talk to your patients about prevention and you educate them on that with good oral hygiene, with good strategies, that is a big part of what we are doing here as well. Our focus really is going to be on making sure that you're safe and your practice is safe by doing these things. And the beauty of this is that this applies to all of you on this call, whether you're a dentist, you're an optometrist, you're a veterinarian. The same rules apply to you across the board. And so we're going to go into that into great detail. And as you can imagine, like a lot of things in life, HR is all about the small things. It's all about the small things, the things that we sometimes forget about, the things that sometimes we don't consider as being important, but they are very important. And we're going to go into detail about those, because if you can handle these small things, then everything else sort of falls into place, right? Everything else falls into place. And so it's really exciting to be able to kind of share this with you, and more importantly, create a real plan forward so that you can implement it. As some of you have maybe know, my wife is a pediatric dentist, and this is my family. And this is our latest picture of the family. And I've got the daughter in high school now, which is kind of crazy to me. But the reason I show this picture is because I live your life, right? My wife went through everything that all of you are going through and have gone through, whether it was, an associateship to, a partnership to, an associateship to maybe buying a practice or doing a startup. And now you're in the middle of COVID with HR issues and struggles and questions, and you don't know where to turn to. And so we've been there, right? I've done that with her. I know what you guys are going through. And that's why this seminar is very important, because it's very practical. Very practical. We're going to talk about things that you can implement immediately in your practice, not theoretical things that are nice to have and things that you should do. We all should do stuff, right? We should all exercise more. We should all eat better. We should all not touch gluten. All those things we should all do, but we sometimes don't do. And so here, we're going to break it down so that you can easily implement it. And I'm going to show you how HR for Health makes your life super easy in that regard. and it allows you to kind of do it very quickly and efficiently, so you can put it behind you and never have to worry about it again. As Kim mentioned, I am a healthcare attorney. This is all I do for doctors around the country. I help you buy practices, help you in partnerships, leases, of course, HR as well. And so we can jump into it, and I'm excited to be here with you guys. So here's what we're going to talk about. Here's our agenda for today. So first thing is we're going to talk about HR. What is it and why is it important? And then we're going to talk about the cost of HR. What are the things that are that are tied to it that we sometimes don't think about that cost us a lot of money and some of our profit. And then we're going to talk about do-it-yourself HR strategies and what the risks are there, because we see a lot of that. And then the benefits of HR for health. And then you're going to be able to kind of talk to our team and follow up with them. And I've got some special things for you that they'll do before you ever decide to join us. For those of you who want sort of a paper version of what we're talking about, maybe with a little bit more detail in certain areas, you can get a copy of our 9 common HR mistakes by just texting the word HR profits. By the way, that's just one word, HR profits, to that phone number, 44222. Just text that word and you'll get an email or a text message that'll ask for your email, and we'll send you the white paper immediately. There's no strings attached to it. It's yours to keep and review and have as sort of something, as a resource from tonight. So let's jump into it. So what is HR? And there's this joke that I've heard before that says, the thing that's wrong with HR is it's not the resources, right? And that's right? It's always the human side of human resources that trips everybody up. If there weren't humans involved in everything that we do every single day in our office, if we didn't have our team, if we didn't have that, maybe in certain ways life would be easier as a business owner. But as many of you know, it's really hard and almost impossible to manage and grow effectively a practice without our team. And that's where the complexity of HR really comes into play. And COVID really put a spotlight on that, because everything that happened with COVID, whether it was the initial shutdown and what happened with unemployment and time off requests, and then the PPP money and how that was going to get dispersed, and how sick leave was going to get dispersed, how the FFCRA rules, which some of you, if you don't know, those are the federal rules related to COVID leave, whether it's, because of, being sick for COVID, or because you have a child who's not in school. All of these things surrounded the employee. And it was, it was, and it is in many ways a scary time, because some of these rules were changing, daily and weekly. And that hasn't really changed going into 2021. There are a lot of new rules that were passed, effective January 1 of 2021, and some of those things we're going to talk about. But really, what makes it complex is that there are so many interlaying parts of it, right? They are interacting in different ways, and if you're not careful about how those portions interact with one another, that's where it can get complex. Okay, so let's talk about what those sections are, right? And this is, if you're taking notes or you're thinking about it, this is the areas that you need to really think about that are the hot spots, and we're going to go through some of these, right? So the first thing is onboarding. That is the key component where a lot of mistakes occur, right? Is the onboarding side of things. So what does it take to onboard a new employee? So what documents do you need? And by the way, you need about 12 to 18 documents nationwide. So depending on which state you're in, you're going to need something along that line. If you're in a state like California or Minnesota, Washington, Florida, you're going to need more. You're going to need documents on the higher end. Some other states, it's on the lower end. But the onboarding side is where a lot of the mistakes happen. So for those of you that are on the webinar who are new practice owners, if you go in and you look at your records and you don't have 12 to 18 documents for each and every employee, this is an area of concern for you that you need to kind of look into very quickly. The second thing is administrating benefits. Now, it's funny because benefits used to be call it 5 years ago, used to really just be about, are you going to provide health insurance? And if not, then are you going to provide, paid time off or vacation? And that was really it. And then a wave of change started to occur, right? A wave of change started to occur where, states started to pass sick leave laws, and now you had to absolutely provide sick leave to your employees, and they had to earn it by the amount of time that they worked in the office, and they had to, these really complicated calculations where, they got 1 hour of paid sick leave for every 30 hours that they worked, and some states made it, and some counties made it a little bit more difficult than that. Well, what's happened now is that as those benefits grew, then COVID happened, and now the benefits have increased significantly. Because if you were providing, for example, health insurance, well, there's a whole lot of new rules tied to health insurance, especially regarding COVID. And then there was the FFCRA, which tied a lot of benefits to being out of the office and the reasons for being out of the office. And so administering these benefits is now a lot more complex. And by the way, the obligation, unfortunately, is on all of us, right? As small business owners, we all have to deal with this. And how these companies expect, or how the government expects companies like all of ours, small businesses, to manage all of this is pretty incredible. It's incredible because, unlike the Fortune 500, you don't have an HR specialist working in your office. You don't have someone with a PhD in HR, working there, or a master's in HR working in your office, or an entire department. And thankfully, HR for Health levels that playing field for you, of course, because we do have those HR specialists. We do have those folks with masters and all that working in the office to help you navigate through these issues. And of course, you've got our law firm standing behind all of that. So you've got PhD level education there as well. But the point is that this obligation is on all of you, right? Is on all of you to do. So here's the secret sauce, right? Here's the secret sauce to making sure that you're administrating the benefits correctly. The core of administrating benefits falls into two categories, right? The first category is you got to really know what exactly you want to offer and what exactly you have to offer, right? And our team will walk you through that, because every state and every county in some situations is very different. But the question is, what exactly do you have to offer, and what do you want to offer? And then making sure that you have a good system where that's documented in an employment manual and whatnot, which we'll talk about in a second. The second part of that is the part that that a lot of people miss, which is the timekeeping component, because benefits in a lot of ways are tied to timekeeping. So the more you're accurate with your timekeeping and the more integrated those systems are, then the higher the likelihood of success and the less the opportunity for error and lawsuits. So what does that mean? That means that you want an electronic time clock system like the one in HR for Health that ties into benefits. So when somebody works 30 hours, they automatically get 1 hour of sick leave, because that might be the law, or that might be what your benefit is. And then as they accrue, if they want to use their benefits, they don't have to come to you and ask questions that you don't know the answer to. They don't leave you sticky notes. They go online into their account and they look and they say, oh, wow, I have 8 hours of sick leave. I can take a day off, right? Or I can do this, or I can do that. So administrating benefits is a really vital part of that, really vital part of that. The next side of HR is the payroll side, right? Running payroll correctly, not making sure that you're paying the last paycheck correctly, making sure you've got overtime paid correctly. All those things are tied to payroll, right? Hugely important. Time and attendance tracking, we kind of talked about that a little bit. That really has to do, again, with the timekeeping, clocking in and clocking out correctly, and then having that tied in with a system, that keeps track of all of the attendance stuff. And I'll tell you, we were doing a seminar a couple of nights ago, and somebody asked me, what's the number one marker for good performance of an employee? And a lot of people were throwing out different answers, but they missed the number one thing. If you want to know which one of your employees is going to be one of your best, it's all about tardiness, right? And what I mean by that is that if your employees have low tardiness, the likelihood is that there's a higher chance that they're going to be a better employee than the employee who's late all the time, right? Because as you know, if someone's late, what does that say about their psychology, right? How seriously do they take your job, right? How seriously do they take the office? And they don't, right? If they're missing your morning huddles, or they're running in late and they're not dressed and all this kind of stuff, that can show a lot about an employee. And so you want to make sure that you've got good record keeping with regard to time and attendance tracking, again, tied to the time clock, right? So for those of you who are using, practice management software for your timekeeping, or a payroll company's timekeeping, then you may want to kind of think about that, because those things go, about 30% of the way, but not all the way, right? The next thing with HR is employment document management. As we talked about, making sure that, the performance reviews, doctor's notes, all those things are uploaded and saved in electronically in a safe place. I can't tell you how many times, we've been contacted by someone who's gotten a letter from a lawyer because they're going to get sued, or from the state. And when they go to check the employee records, the records are not there anymore. It's incredible how many times employees kind of get that feeling that they're going to get sued, or I'm not sued, I'm sorry, get fired, or that something bad's going to happen, or maybe they're going to quit and they just want to take that opportunity to sue you, and they take the employee file from the drawer. And that's a problem on a couple different ways, right? One, that drawer is supposed to be under lock and key. You're supposed to have it, protected. But those things disappear all the time. So we just want to avoid that, as much as possible. And then, of course, law updates, with all the, changes with the rules. You just need to be up to date on all of that, and we provide all of that for you. So it's hugely important. These are the core competencies of when we talk about HR, and to minimize risk, you really have to kind of have a strategy for all of these, in a really kind of meaningful way. So let's go through some examples, okay? And these are examples of day-to-day situations that come up that you may end up facing. And I want to raise these because these are the kind of things that sometimes are pitfalls that we forget about because we don't think of them as major issues. But I'm going to raise these with you. I can't go through all of them in great detail, but what I really want you to know is that these are red flags. So if you're not an HR for Health customer and you face one of these things, then you pick up the phone, right? You pick up the phone, you call them, you call me, we walk through it, and we try to figure out kind of how to make you safe. Because the reality is that these are really dangerous kind of moments. Okay, so let's talk about that in a second. Okay, so HR, really isn't a nice to have anymore. It's really a must have. And some people, when they think of HR, they still think of it as a recruiting tool, or making sure that the employees are happy and whatnot. But a lot of that, really right now relies on the federal state rules that you just need to be sort of aware of. And just like you have malpractice insurance to protect you against patient lawsuits, HR, compliance really can start with HR for Health, because it is, the cheapest insurance you can buy to make sure that your risks are really low. Okay, and so part of the HR requirements as well that sometimes people forget is, OSHA and HIPAA compliance, right? OSHA and HIPAA compliance. So how do we deal with that, right? Like, how do we deal with those? And those are, vital parts of the compliance that we are talking about. Now, HR for Health doesn't do any OSHA and HIPAA compliance, but there are folks that we can refer you to that can help. And then I think that, will again be another step in the right direction. So let's talk about these day-to-day situations now that you have some of this background. Okay, so one of the questions we always get is, do I have to pay for overtime that isn't approved? Okay, so now that's a key portion I want to bring up. Do I have to pay for overtime if it isn't approved? Now, if in your state you have an overtime rule, and most states have either their own rule or they follow the federal rule. So depending on your state, almost every state, you have to pay overtime if somebody goes either over 8 hours in a day or 40 hours in a week. And sometimes it's both, like California, it's both of them. So what does that mean? Well, what that means is that if you have in your employment manual that overtime must be approved, that's great. That's what you want. You want to put something like that so that if someone is working overtime without your knowledge, or they don't get that approval, that you can use that as a way to write them up. And that's important for you to know, because it is a performance issue. But here's the mistake everyone makes. Okay, here's the mistake everyone makes. Just because they need approval does not mean that you cannot pay them if they don't get that approval. So in other words, if they work overtime, you must pay them, right? No matter what. Now, that doesn't mean you don't get to write them up. It doesn't mean that you don't get to talk to them. It doesn't mean that it's not a performance issue, but it does mean that, that you still have to pay them. But then, by having that language in your employment manual, you can take advantage of it. So remember that, hugely important. The next question that we get is, can I hire volunteers, right? Can I hire volunteers in my office? And volunteers, volunteers is kind of a tricky situation. If you're an intern or whatnot, I think, they're getting school credit and things of that nature. It can be okay as long as you go through the proper, paperwork. But volunteers in and of themselves is kind of a scary place to be in a private business. And this kind of all started many years ago in Congress, because those interns that were working for congressional folks started complaining about being paid, and they were saying, look, I should be paid at least minimum wage, and the courts ruled in their favor. And then what happened was that around the country, volunteers and other interns started having complaints about not being paid. And so here's what I would say. Volunteer work in a dental practice or medical practice or veterinary practice or optometry practice is really kind of non-existent, right? You can't have volunteers donating their time. Now, again, you can potentially have an intern, right? You can potentially have an intern who's maybe getting school credit and they've gone through all the right paperwork, but a volunteer in of itself is probably not kosher. And if any of you have volunteers who work for you, let me know. By the way, as an aside to this, if you have any employees who volunteer to work more for free for you, that is an absolute setup, okay? Absolute setup. Like, I don't care how nice a person is, I don't care how nice you are, how long they've been with you. Trust it from me, if they are volunteering their time for free, it is an absolute setup, okay? It's an absolute setup, and I'd be happy to talk to anybody about that. All right, the next thing, let's talk about working interviews. Now, most of you, if not all of you, hopefully are doing working interviews. Some people like working interviews, some people don't. It kind of runs the gamut. I think they're a good thing, but they can be a problem area if not done correctly. So you want to make sure that with working interviews, you do a couple things, right? And one is you want to make sure that you communicate this, how much you're going to pay them, when they should arrive, when they should leave, all those things before the person starts, okay? Before the person starts. You don't need to give them all the HR documents that you need to have for all your other employees, but you want to be clear about, what they're going to do. The problem that I see a lot is that I see doctors bringing in working interviews and not paying them. And the law says that as soon as they do any work, right, they pick up a phone, they put a handpiece away, they do sterile tech, they do whatever, that is work, and that needs to be paid. So it's important that you communicate how much you're going to pay them. And so just remember that. Another question I get a lot is, hey, they have some of my practice property, they have scrubs, they have loops, they have some frames, they have they have stuff of mine, what can I get that money back if they leave, they quit, or if I fire them? And the answer to that is, unfortunately, you cannot, you can't deduct their pay for that. If they've taken it, and you weren't careful sort of about how to manage it, then unfortunately, you just have to be careful. But deductions of anything like that from regular payrolls or final payrolls is a big no-no, okay? Big no-no. Remember, everyone, I want you to know these as red flags so that if any of these things happen, you pick up the phone and you call us and we help you through it if you're a client or not a client, right? So that's kind of the goal right now. What happens if an employee doesn't show up to work for their regular shift? Happening a ton these days. Everyone's kind of using the COVID excuse, and I think there's a little bit of a wink, wink, and people kind of know that a lot of that is potentially maybe not as not real in some situations. Of course, I don't want to say that it's true across the board, so you have to be very careful. But people do sometimes not show up, and so how do you handle that? Well, you need to have a strategy for it, right? You need to have a strategy, and remember, if you let one person get away with it and you don't follow your strategy, then you may end up having to do that with everybody and being that lenient with everybody, and that's not a great place to be. You really want to be focused. You really want to follow your own rules. Maybe you give a little bit of leeway, the first time it happens, but after that, you want to make sure, you're there. Can I or should I approve vacation requests? And the answer to that is yes, absolutely. You should absolutely have vacation requests, approved by you. And there may be times in the year, right? There may be times in the year where you don't want anybody to go on vacation. At the end of the year, when patients are coming in with all their insurances, that's probably the worst time for someone to take a vacation. And I'll tell you, that's okay. That's okay. Put that in your employment manual. No vacations will be granted in December, right, or January, or any other time. So just don't say from January 1 to December 31, no vacation requests. That would be bad. But other than that, you can dictate that. And if your office is closed because you're going on vacation and you want everyone to kind of take those times off, you can make some special rules around that too. So, as an example, my wife and I, we travel for 4th of July, and her office is closed all of that week, and her team knows that, and they've known it for the last 12 years, and so they all take vacations during that week, and they get other vacation time as well. But that's the week that they go on vacation, and it's become sort of a fun thing for a lot of them because it's something that they can count on every year. So let's go to now talking about sort of the importance of HR, because we've talked about some of these pitfalls. These are the common scenarios that happen all the time in practices around the country. And HR, as most of is not something that can be ignored anymore, of course, not just because of COVID, but because the rules are just getting more and more complex. And so it's one of those things. It's like a ticking time bomb in the sense that these things add up. It's cumulative. And what I mean by that is that an employee or employees will do little things, or you'll let little things go for a while, or you will not have done certain things like the new hire paperwork that we talked about and whatnot. And then nothing happens, and then there's this like false sense of security that kind of falls over you because you feel like the employees are loving you and they're nice to you and all that. And then sometimes once that happens, that's when suddenly something bad comes up. Because remember, a lot of these employees know these rules much better than you. A lot of them have kind of played in this world before, and they know that there's big dollars, right? There's big dollars, at stake, and and a small overtime error, could be a $30,000 penalty, for you potentially, and so those things, are things that you just have to kind of know because there are so many of these small rules and regulations that as a small practice you just have to kind of keep mindful of. And what I can tell you is that, and this is a scary thing, but about 95% of all the rules that apply to you apply to the Fortune 100 as well, right? So think about that, right? All the rules that apply to the biggest companies in the country apply to small practices as well. And that's one of the reasons why HR for Health really kind of steps into that void, because we even the playing field, right? You don't have to go hire a team of HR people. You don't have to figure it out yourself. By the way, there are lawyers, healthcare lawyers out there who are don't know these rules and are giving bad advice and are giving this. Why? Not because they're trying to, but because it's complex, right? And it's hard. It's hard. And so for you who is a practitioner and you're in business all the time, it could be even more difficult for you. So just kind of keep that in mind, and know that the goal here is to kind of make things easy and make sure that when you're terminating somebody or you're doing something for them, trying to improve their skills, that you're doing it the right way, right? The right way. The reality is that on average, a case that we see, with attorneys' fees and settlements and all that, it's somewhere between 1 to 2 times an employee's salary, right? 1 to 2 times an employee's salary. So if you're paying somebody $20 an hour, that could, that means that settlement and that lawsuit for you could cost you anywhere from 20K to 40K. I'm sorry, 40K to 80K, right? If they're earning $20 an hour, and that's a big dollar amount, right? That's a huge dollar amount for small practice, and it just doesn't make sense. I mean, if you can spend $200 a month and save potentially 40 to 80K on one error, that is about as no-brainer of a solution as there is. Because the reality, right? The reality is that those errors are probably happening, right? It's probably already happening. But the secret sauce in our secret sauce, if you will, in our law practice, and HR for Health knows this as well, which is one of the reasons we're able to get so many people out of trouble, is that if you fix your HR issues before somebody goes to the state and files a complaint, or before they file a lawsuit and get a lawyer or whatnot, you could potentially avoid all those penalties, right? So that's rare, right? That's really rare in life, where you can make some mistakes, but as long as you fix it, before it gets too crazy, before they go to a lawyer or whatnot, then you could be okay, right? You could be okay. And but the question is, you just don't know when that is, right? And so the sooner you do it, the better off you are, because the reality is that you just don't know when that could occur, right? When that could occur. So take us up on it, because it's one of the reasons why our team does these HR audits, right? We do these HR audits because our goal is to tell you, here are the things you're doing great, right? Here are the things that need improvement, and here are the critical items. So let's fix these critical items. Let's go to fixing those things that need improvement, and then let's build on the things you're doing great at, so that you really get amazing employees, because that's the end goal, right? That's the end goal. And happier employees means happier patients, which means patients who pay you on time, who don't argue about fees, who accept treatment plans, who upgrade to the more expensive frames, who take your recommendations, who buy supplies and other things. That is the definition of practice success. This is an absolute point that I think the best of the best folks know, and the best business people and entrepreneurs understand, which is that you don't start with the profits, right? You always start with happy employees, because happy employees will take care of patients, which will make them happy, who will then take care of your bottom line, right? Bottom line. And that is the core of business. I wish more business schools talked about it that way. They really don't, unfortunately. They always focus on the economics, but that's the last piece of the puzzle. But here are some added benefits, right? Here's some added benefits. You also have reduced employee turnover. Now, for most of you, you know what I'm about to say is absolutely true, unfortunately, which is that there is 100% employment. 100% employment in healthcare, right? Whether you're an optometrist, a dentist, a veterinarian, a physician, it doesn't matter, right? There's no hygienist, RDA, nurse, optician, office manager that's out of a job. I mean, absolutely not. They can get a job anywhere, anytime, and more importantly, there's just not enough of them out there, right? There's just not enough of them out there. So we've got to keep the employees that we have. We've got to keep the employees that we have, at least the ones that we want, and the ones that maybe we don't want, we have to try to improve them, because it's more costly to replace them. So let's try to improve their performance. If it works, great. If it doesn't work, through some of the strategies that you can implement with our team, these employees tend to leave on their own. You reduce your turnover, and then here's the thing: you keep your key employees. We all have our favorite employees. We all have our key employees, the folks who we rely on left and right, and you reward them right with accolades and promotions and raises and all that stuff. But you also need to do the little things that make their life easier, that show them that you value them, that they and those things are the things that we sometimes forget when it comes to HR, and those are the kind of things that we can show you how to do in a really kind of effective way that also increases the performance of the rest of the team. So hugely important, hugely important. Honestly, this is the part that excites me the most, because it's something that we developed on our own, that's unique to HR for Health, and we are able to increase performance by doing performance reviews the right way. And a lot of that is tied to our time clock management and some of the other tools we have. So I'm really excited for you guys to see that one day, hopefully, and please ask our team about it, because they'll knock your socks off with that. So now let's talk about some do it yourself risks. There's always ways to do things yourself, and a lot of you, if you're anything like my dad or my sister or my wife, who are all doctors in one way or another, they all like to sometimes do things on their own. And I have my master's in tax, and I for many years did our own taxes, and my wife's business and my business and all this. And I'll tell you, at some point I realized I am not making any mistakes, but I'm not doing as good of a job as somebody else could do, right? And I think that's the key, right? That's the key, is can we do it so that somebody else does it better? And the answer to that is an absolute yes. It can, others can do it better, and doing it yourself just increases that likelihood of potential problems, right? Potential problems. So just be careful of that, because if you get an employment manual from a payroll company, or you get it from some other company, they're giving the same thing to you that they're giving to a laundromat or a coffee shop. So it just doesn't work. And more importantly, it takes you away from patient time, right? It takes you away from patient time, and that's the issue, right? You make money when you're spending time with patients and with your team, not worrying about what the HR laws are, not making sure that you've got everything covered. And that's where a lot of these problems occur, because you're not going to catch them all, right? You're not going to catch them all. And things like we talked about, miscalculating vacation time, PTO, sick leave, overtime, not tracking benefits. All these are things that are potential problem areas. Okay. So before I get to your questions, and I know there's a bunch of them, let's talk about the benefits of an HR software like HR for Health. There are a couple out there, but of course, ours is I'm kind of biased towards it, because I think it does everything as opposed to claiming to do everything. I think ours actually does it all. It prevents your risks, reduces your liability immensely. Because as you know, without having the right HR procedures and tools, your penalties are through the roof. We're super efficient because everything is electronic and online. Through electronic signatures and timestamps, everything is done, so you don't have to ever print paper or worry about that. And it's all transparent and integrated, right? It's all integrated, and that is huge, because the automation that comes through makes your life easier, because now things are done for you automatically without you kind of worrying about it. Of course, we've got the compliant timekeeping, which, as I mentioned, is the core of the functionality. It's the engine that runs everything. And then the electronic documentation. You really want to make sure you've got everything kind of documented for yourself in sort of an efficient way, so nothing's lost. Here's a quick picture of the site. Very modern, and looking easy to use, easy to understand, but you have to really see it in action to appreciate it. So I hope you guys go through that. And our mission is really simple, keeping you safe, right? Absolutely keeping you safe all the time. And we've broken that down into three categories, right? Three categories. One is that we have HR advising, And we want to make sure that from the time you come into the office, from the time you leave, HR is sort of a small part of your day, so that you can really focus on everything else that you're doing, because that is really where you're allowed, you can increase your profits and minimize your expenses, is focusing on the patients and focusing on your team, and not necessarily on all the HR laws. Every case that you come up, if you have questions, we have case by case analysis done by our HR advisors. If for some reason it's more legal of a question, it comes up to us at the law firm, and you have lawyers that work for you, and which is incredible. We'll customize an employment manual just for you as well. If you would pay $3,000 to $5,000 for a law firm or someone else to create one, we're giving it to you as part of our service. More importantly, you get an updated one every year with the new laws. So you just basically have to do it once, and then you're good to go, unless you make drastic changes to your business. And then finally, on the wage and hour claims, which is the overtime and the lunches and breaks, which is the top lawsuit, we have a ton of documentation to protect you there and make sure that you're safe. Because if you do get stuck in a lawsuit, that's the time that you need us, and that's the time we have the documentation. All right, okay. So I know we went through a lot, but let me go through some questions now, because this is, I think, a big part of what you guys may be asking. And remember, this is, there's no bad questions. Make sure you ask anything that you're worried about. Before we get there, though, let me go through a couple things with you. If you guys want the 9 common HR mistakes, please, type in the word HR profits and send it to that phone number, the 44222, and you will get the white paper. So that's really important. And I'm going to end before we get to your questions, on this very important point, which is, this is the moment of truth, right? This is the time for you to decide, what are you going to do next? And here's what I mean. If you're anything like me, you spend tonight and you're going to probably finish and maybe go have dinner and have a drink and kind of relax. And you're going to forget a lot of this stuff tomorrow, right? You're going to forget a lot of this stuff, because tomorrow you're going to be back at work and it's going to be business as usual. And so let's not forget that. And the best way not to forget that is to tell the universe what we believe is important from tonight's seminar. So what I'd like you guys to do is to take out a piece of paper, or you can do it on your phone, but I'd like you to write down one thing you've learned tonight, one thing that you want to do in the next 7 days. And then I want you to take a moment and write something that you want to do in the next 14 days, right? In the next 14 days. And then finally, one last thing you've learned tonight, right? And it could be, I'm going to do an HR audit, or I'm going to, get a new employment manual, or I'm going to check and see what those 12 to 18 documents are, because I have 3 of them, whatever it might be. You want to write these 3 things down, so that you start to immediately take action on them over the next 21 days. And what's incredible is that, by mid-March, you will have done 3 major things to keep your practice safe moving forward, right? 3 major things to keep your practice safe moving forward. So I encourage you to do that. And if anybody has questions about HR for Health, and you want to have a demo, have one of our team members do a complimentary audit for you, so kind of what's working and what's not working, please go to this link, and they will schedule you a call, and they'll do an audit with you, give you some good information, show you the software as well, to see if it's a good fit for you and your practice. And of course, I'm always available for questions as well. And I see one question here, which is, what are the top 3 times that that I need to be careful of? And so here's what I would say. I'm going to reword that a little bit, but here's what I would say is, anytime you are firing someone who is either pregnant, older, so that means anybody between 50 to 60 years old, or the technical rule is 40 years, but I'd say 50 to 60. Or if they've been injured, they've got workers' comp, they've been injured on the job or at home, or they have COVID. Anytime you're in that kind of environment, before you fire them, right? Before you do anything, before you retaliate against them, before you do anything at all, pick up the phone, call HR for Health, call me, let us walk you through it so that we can keep you safe, because those are super high risk, super high risk moments, and you just want to you just want to be careful. And so Kim, I know you're here. Maybe we can put in the chat box for everybody my office phone number here. I'm going to put my office phone number, everyone, in case you have questions, so that you can call the office. I'm going to also give you my email as well, so that you can email me if any of you have questions now or in the future about HR stuff, because we want to be a resource for you. That's why we do these things. So I've got that there on the chat side as well. So Kim, do we have any other questions? Anything else that's popping up?
We did have one come in that said, someone, Danielle's in Pennsylvania. She says she gets a lot of phone calls about labor law posters that they have to post, and that they should buy them through certain companies. Her understanding is that they do need to have them, but do they have to come from a certain company? And is this something that HR for Health can help with?
Yeah, great question. Great question. So yeah, these posters do come. You're going to get a lot of advertisements from a lot of people regarding these posters, and no, some of them are, they sell them to you for hundreds of dollars, and the reality is that here's what I would do. There's two ways you can get them. Either you get them from your state association, right? So a lot of state associations provide that as a benefit to their members. So I would make that call. If they don't have it or they don't provide it, which some don't, then you can get it from HR for Health as part of your membership. We give that to you as well, as part of it, so that you can put it up. But I would do the state associations or that. It should really cost no more than $100 if you're going to buy it from somebody. But if you sign up for HR for Health, we'll give one to you, or your state association sometimes gives one to you for free as well.
Someone's telling me we do have them as well. HR for Health has them, so that's great.
Yep. Perfect. Yep.
All right, and then we did have a couple of questions about the working interviews. Well, here's one. If you close your practice for a holiday, do you need to pay the employees for the time the practice is closed?
Yeah, great question. So if you close your office for a holiday, it doesn't have to be a paid holiday. It could be an unpaid holiday. It's not like the federal government. But that all needs to be dictated in your employment manual, right? That all needs to be dictated in your employment. Now, I'll be honest, in many medical practices, small practices, the reality is that if the office is closed for more than a few days, like if you're closing it for a week or so, sometimes a lot of offices do pay for that, simply because people can't be without a paycheck for, let's say, a week. But what I would say is I would dictate maybe 6 to 7 holidays throughout the year that maybe you are closed, and then you kind of go from there. Now there's no federally required holidays. So in other words, you don't have to be closed on any federal holiday. You can be open every single day of the week. You can be open on Christmas if you wanted. But of course,
your employees won't like you very much. But
yeah, no, thank you. Yeah, exactly. Thank you very much. But it's so you pick the holidays that are important to you. Now, my wife, for example, she works with kids in her practice. She's a pediatric dentist, and so for her, she's not closed on President's Day and Martin Luther King Day. And the reason is because those are school closure days. And so she's super busy on those days, as you can imagine, right? But like 4th of July, that whole week she's closed. Why? Because parents travel with their kids all across the country. So she has found that week to be a slow week. So she's closed that week. And so those are the kind of things, but you don't have to pay unless you dictate it.
Excellent. And then one more, let's see, this is probably the last one. Somebody said awesome, Ali, so bravo. We have, if you, for working interviews, can you pay cash or do you have to run it by through payroll?
Oh, good question. So never pay cash, right? Never pay cash unless you're gonna pay your lawyer. No, I'm just joking. No, don't ever pay cash, because there's no proof of cash. And I have had people pay cash because it was just easier, and then the employee came back and said, I never got paid, and so on and so forth. So don't do that. But you have a really good question, because what I would recommend is, yeah, please give them a check. and you don't need to take any deductions or anything, right? If they're only going to work with you once, the IRS doesn't seem to care. You just give them a check and that's it. But if they come back, let's say, and they end up becoming an employee of yours and they work for you, then you don't want them to work more than 1 day, without putting them on the payroll and all the legal HR documents. And the reason for that is that IRS has like a guideline around that. Now, I will tell you, if you go to a super strict HR person, they will tell you, no, every person that walks through that door needs all of the HR documents. And they are technically correct, right? They are technically correct. But we have to be real. And the reality is a working interview, a 1-day temp that never comes back is unlikely. You're unlikely to give it to them. And so I would just get some basic information, get their resume, and then make sure you pay them. So.
All right. Well, I believe you've answered all the questions. So anything else you'd like to add?
No, I think that's it for me. I wish I could. I wish I could see. I wish I could see. Oh, here we go. I think I can see the questions now. So yeah, I think if we're good, then I'm good. Please, guys, you have my information. Please don't hesitate to contact me. We are here to support you. That's why we do this. We love you guys, and we want you to be safe. So please reach out to us if you have any questions. All right.
And don't forget, you can text HR Profits, one word, to 44222 for your free white paper. And yes, thank you guys so much for coming, and we'll see you next time.
Bye, everyone.